Thank you. Right. Ji, anyone from the class who can tell me what is being shown in this slide?
It is some sort of a machine, wheels, and they are interconnected with each other with the basically with the timing. One moves and the other is rotating according to it.
Thank you very much. Very nice suggestions that there is something like teamwork and coordination. And one, if works very hard, the other alignment should be correct too. Right. So this is very important while we are doing research, and we will see how it happens in our research. So what is research? According to the Oxford Dictionary, it is an investigation undertaken in order to discover new facts or to get additional information. So whenever we talk about research, we always talk about two important things. One is new facts, other is additional information. If there is any research that is for new facts, like for example discovery of something that is new for the whole of the mankind, then it is a very important part of the research. Second, we already know many things, but we need additional information. uh, for example, I would give you one example that COVID-19, it was a new disease, and everyone here is not very much sure about the epidemiology, treatment, vaccination, and all other aspects of COVID-19. So what was done? First, SARS-CoV-2 vaccination was developed. So it was a new thing. So discovery of SARS-CoV-2 or COVID-19 vaccination, it is research. Second, after getting the vaccination, what are the antibody titers? How they are being developed? Either the people are being protected after first shot of the vaccination or the two shots. Even Johnson and Johnson, they have claimed that their single shot vaccine, it is very effective. So this is the additional information that has been gathered, and this is the part of research. If there is a well established fact, for example, we all know myomectomy, it is one of a standard operating procedure for having fibroids. Do you think it is research if I want to work and want to find out is myomectomy treatment of fibroids in uterus? Dr. Sadia, you spent a lot of time in gynae, so yes, you are right. That no. Why? Why no? Isn't it a new fact or additional information? Do you think that it is not a new fact, neither a something that is called additional information, right? However, if there is some modification in established facts, or if there is some challenging thing that leads to our new understanding of any fact or about the information, then yes, it is research. If you, if from the class, if you can give me any example of discovering new fact or getting additional information, you all are very well experienced and you all have spent a lot of time in medicine. So I want you to please give me one example of new fact or additional information. Dr. Mehreen?
And discovery of the new drugs like Azomax for COVID-19 as compared with ivermectin for COVID-19. It was a new thing.
Okay. Thank you very much, Mehreen. Actually, both the drugs, they are still under trial. We don't know whether they are having the effect on COVID-19 or not. And most of the trials, they have shown that Azomax, it has no effect in decreasing the severity of COVID-19 as well as it is in decreasing the complications of COVID-19. Similarly, ivermectin, again, it is a trial drug. It is a research drug. So if there is some discovery about it, it would be in additional information. But at this point in time, we don't know whether this ivermectin or Azomax, they are decreasing the severity or complications or the clinical features of COVID-19. So more research is required on this. Any other example? Dr. Satya, if you unmute, please.
Ma'am, regarding STIs and syphilis, as this is very common in females, the new discovery of its vaccine for the young girls, teenager girls, I think is a discovery towards the previously diagnosed disease. It's a new fact because it's going on, and I don't think so. It's an additional information, if I'm correct.
Thank you so much, Dr. Satya. The important point that we must remember here is all those informations that are being gathered during clinical trials, vaccination trials, or when we don't know about anything, our research question is there, and we are addressing the research question in the form of what prevention would be offered by that vaccine. It is the part of research. So for the vaccines, there are certain trials like there are animal trials and human trials. The human trials are further divided into 4 clinical trials. First is the clinical trial with very little uh, amount of information that is available and very less number of the participants. They are usually less than even 100. And it is clinical trial 1, and they are all are volunteers. In second trial, yes, we have more than 100 of people, and usually they are in thousands. And again, this is all those are volunteers. In phase 3 trials, we have more than even thousands of volunteers who are in the clinical trials. And in phase 4 trial, after the marketing or availability to the general public, we have this important trial to find out the side effects and amount of the protection that is given by any vaccine. As far as we know that COVID-19 is a disease, and we know that for 6 months for sure, the antibody titers, they persist in many people. However, what is beyond 6 months, we don't know. At this point in time, vaccination, we know it is the only solution for COVID-19 pandemic to be stopped. And how long its immunity that exists, we need further research on it. And that would be the clinical trial 4. So what we have discussed so far, if I sum up it, research is a systematic collection, analysis, and interpretation of data to answer a specific question or solve a problem. If you can see, the most important point in research is systematic. If you don't have the system, you are not calling it research. The second important thing is how you are collecting data. That is very important. It depends upon your data collection tool, how valid it is, how reliable it is. Similarly, if you are using instruments, how to check the calibration of that instrument. If you see in a picture, you can see there are different people. Some are using microscopes, some are using different reagents, some are using centrifugation. So the standardization of the equipment, that is a must in doing any research, so that any other person who is having the same equipment or having the same environment can produce the same results. And that is very important for the reliability. So research couldn't be done with the collection tools if they are not valid and reliable. And what is validity? We would be talking more in detail tomorrow. But for today, I would like you to know that there are different types of validity: internal validity, external validity. Similarly, we have our validity tools like content validity, construct validity, for checking validity through face-to-face and experts' opinion. And then all these help to find out that the tool that we are using for data collection, it is really meant for that research. If that data collection tool that is not reliable, that is not valid, or even the instruments or different herbs, or there are different specimens that have been used in research, they cannot be standardized, then our analysis and interpretation of data to solve a problem will be consisting of bias and lot of confounders. And all these different things would lead us to more problems rather than for solving a problem. So what is different interpretations of data? We would see it that even there is a collection of data, but still if the analysis is not proper, if it is not the proper sample size that has been taken, if it is not the confidence intervals and power of the test that has been defined during analysis and during sample collection, the whole process of interpretation of data, that is under question then. So what is research? It is the answering a specific question. And why to answer a specific question? Because we want to solve a problem. But if our research methods, they are faulty, what we are producing more problems rather than solution to any problem. If you want to add anything, I would like to listen to your comments too. Dr. Daud, if you unmute, please, and let me know what is your experience about the unsystematic collection, analysis, interpretation of data, and how the different problems that you face during your research.
Unsystematic collection or analysis or interpretation of that data that may end anyway there without any conclusion or any wrong conclusion. But we see here that we lack true data there, and the building constructed based upon that data is altogether faulty eventually, and its analysis and interpretation that comes out of that particular data that ends up in the wrong solution of the problem.
I have asked a question for a specific reason, because I know that you were having a very good question and you want to answer it. And what you have tried, you want to purchase a tool. And unfortunately, it was very costly, and the research grant that was not being granted within time frame. So you have to change your whole research question. That is why I have asked you that why you want valid, reliable data collection tool, and why you want to purchase it, and why you want to answer the question in a very systematic way. And if I only tell you briefly about that, because there are many other participants who don't know about the whole thing. Dr. He tried to answer a very good research question, and for that there was availability of a valid and reliable data collection, but it has to be purchased. And we tried to get some grant. Unfortunately, we couldn't get in within time frame. And then we decided to change our research question so that our data collection should not be biased, and its analysis and interpretation all depends upon the data collection tool. If the data collection tool is not available, how can we proceed further? So that is one very important part, that the system cannot be made if the collection is faulty. What is happening here? Most of the researchers, they are making their own questionnaires with their own sweet will, without even having the validation or the reliability testing. And if they were being asked about Cronbach alpha, they even don't have any remote possibility of testing it in certain populations to get the reliability through Cronbach alpha. Similarly, the validity testing, when we ask them how the validity tests have been performed for content, for construct, and for other important aspects of validity, still they don't have any answer. So if the data collection tool that is not proper, how can we proceed to analysis and interpretation? How can we proceed to the solution of a problem? So the most important point that I want to stress here is the system. And if the system, it is starting from a certain point. And the first point, or the nidus, or the starting point, is the data collection tool, data collection instruments, data collection specimen, data collection environment, data collection training of the staff. If the researcher is doing everything by himself or herself, that is excellent. But for certain reasons, if he or she can't do it, then he has to train other people and make them standardized through the training system or the assessments before asking them to help in the collection of the data. Similarly, if we have more than one observer, we have to calculate inter-rater reliability. If we have more than one data collection tool, then we have to do the thematic analysis. We have to do the triangulation of the data. So it all starts with the systematic collection. And we can't say that during data analysis, the things will be controlled, the confounders will be controlled. If your data collection is not right, believe me that there's no statistical statistical test on earth that can control the confounders or that can decrease the bias if the starting thing is missing. If you don't have a proper data, how can you do analysis? Similarly, there are many people who ask me when I ask them that I don't think that your data is trustworthy, then the first question is, how, madam, you know? Because the data analysis would help us to find out that this can't be the real data. We have so much data that is available through different sources. If it is not being in coherence, or it is not being aligned, and the data analysis tests, they are showing it that it is not trustworthy. So what else can be done? So the whole dissertation or thesis or research paper, the whole effort, it got wasted once the system has not been followed as such. I am not talking about plagiarism here. Plagiarism is something else. It is kidnapping. It is about having the credit of someone's not to be given to that person. So sometimes in data collection tool, there are the certain ethical elements that has to be done, and that has to be taken care of. Similarly, there are aspects of plagiarism that has to be taken care of for data collection tool, and we would discuss it later on, because plagiarism, again, it is a very long topic. Similarly, in data collection, there are many other considerations that have to be seen. First is the feasibility. Whatever you are doing, is it feasible to do it? For example, someone from my students, perhaps they would say that we want to develop a very good vaccine for COVID-19. Do you think it is feasible? Yes, it is a good, passionate statement, but it is not feasible. Second, what is the relevance to your program, whatever degree program you are following, whatever research that you are being done for a certain objective? What is the relevance with your own expertise that you have developed over time, and what is the relevance with your own field? If there is no relevance, then I think that you shouldn't intervene into the fields of others. There are many people who are social scientists, or they are having different expertise. They can collaborate with the other people in order to get the systematic collection of data, rather than playing on someone else's field. It's just like a cricket match. If you are a good bowler, you are a good bowler. You should play at your own strength rather than trying to be a batsman. Similarly, the other important things is about ethical considerations, and ethical considerations are very strong when we talk about any research. You have to take care of all those ethical principles that are laid down in Nuremberg Code, in Belmont Report, and latestly we have Helsinki Declaration and World Medical Association that is telling us about those ethical considerations. They start from being veracity, truthfulness, trustworthiness, and it is about non-maleficence, no harm, and how the consent forms should be taken for, and what is the beneficence, what is the different autonomy aspects that has to be taken care of, because every person has to be given the full information of the research, and he has or she has the complete right to withdraw from the research at any time where they want them to be withdrawn, and without any coercion, without any force or hidden threat. We will talk more about what is coercion, what is threat, and how they do differ from each other. So in our few other presentations, we will talk about more about the ethical consideration. Similarly, we have justice, and justice means equitable distribution. We would talk more about what is the difference between equality and equity, and how the principle of justice, they are fulfilling the different criteria that has been laid down in medical literature. Similarly, we have all those important aspects for the health. Once there is any drug or vaccine, how the side effects has to be covered. Each and everything has to be very clear, and the safety information along with the researchers' whole document should be the part of any research. So So the systematic collection, and then we would talk more about data analysis, how we see the distribution of data, what is the normal distribution, how the distribution is skewed, positive skewed, negative skewed, what are the different distributions, including Poisson distribution and t-test distribution. And once the distribution of the data has been made very good in documentation, we would further proceed towards the test like parametric test, non-parametric test, when we have to make hypothesis and when we have to check the hypothesis and when we have to approve or to show that hypothesis is working. And this making of a hypothesis, how the deductive research, it is different from inductive research, how the literature review that helps in interpretation of the data. So whenever we are doing the interpretation of data, the first important thing, we have certain results. First of all, we try to explain our results, that either these results are in agreement what others have found. If they are in disagreement or what others have found, so there may be the element of error or bias, or there may be confounding effect, or there are some solid reasons that why they are different. So that whenever we are doing interpretation of data, we have to do a lot of literature review. And we would also talk about that whenever we are doing all this research, the most important thing in any research is literature review. Without doing any literature review, we can't even think of the research question. Whatever research question is formulated, we are basing it on the existing evidence. We are having that base of existing literature before we go to the interpretation of the data. Once the data, it has been interpreted, we have to know what are the strengths, what are the weaknesses, what are the opportunities, what are the threats, what are the ways for future research. And a good researcher always know that these are my limitations. And any further research that is required, and this is the point where the other researcher can have a research question and can go along with the same research methodology to answer few other questions that has not been answered in my research. So a good researcher always give a room or a research questions or a space to the other researchers to do work and to interpret the data. That is why we always talk about citations. The citation is whenever you are reading any good article or you are doing interpretation of your data on the basis of the agreement or disagreement, you always give the credit to the person who has performed before your work. And this is the importance of citation or references. And the citation and references are so important that it gives this image that how serious a researcher is with answering the research question. The second important thing is the citation always help us from decreasing the chances of plagiarism. If you have cited someone, yes, this is a very nice thing for avoiding plagiarism. Another important thing that we have to remember in science, that there is someone who has done some work on the same research question in any part of the world, and that scientist has done the work for your benefit, and you should take part in the research to extend his boundaries of research and to take that vision again to a next level of evidence. So I always call it like marathon race. Like a marathon, you have to give the other person chance to run in the same court and the same track, so that in promoting the research. So why we are having all this research, just for one reason, we want to solve a problem. And this is the collective wisdom and the collective activity that would help us in solving any problem. However, there are problems that are context specific, that are specific to certain environment. And if somebody wants to answer that question in their own environment, that is how they are helping in the highest level of evidence. We know the highest level of evidence comes from meta-analysis, from systematic reviews. We know the next level is from multi-center randomized clinical control trials. Then the evidence comes from case control studies and cohort studies. Then we have other type of observational studies like cross-sectional studies, and very little level of evidence or very little emphasis has been given to expert opinion. Why? Because expert is a single person. However, when we have multi-system disease, or we have a multi-variable analysis, or we have multi-center study, or we have a meta-analysis, what we are doing, we are collecting data from the different parts of the world, from the different experts, from different regions, different geographical boundaries, from different cultures, from different contexts. And that is the beauty of research. And that is given us the highest level of evidence. So the best solution of the problem, now please let me know, what is your thinking about it? From where the best solution of the problem would come? From a single person, or from a multi-centric trials, or meta-analysis?
Meta-analysis.
Meta-analysis. Meta-analysis. What is meta-analysis actually?
Analysis of different studies are then combined.
Okay, you have done the literature review, and after the literature review, you have seen that there are certain sample sizes, there are certain observations, frequencies, percentages, and there are the data sets that have been analyzed. All the analysis would be done again with the larger sample size by combining all those samples, by having all those frequencies to be added up. And if you have certain inclusion exclusion criteria, you have to exclude or minus those sample numbers or frequencies from that data, and you have to run all the analysis again. And that is meta-analysis. And why it is so strong, what is the strength of that data? You have a large sample size, you have different centers that have been involved, you have different geographical areas that have been involved, and the element of bias or confounding, it's so low. So that is why the meta-analysis has the highest level of evidence. So whenever we are towards solving a problem, we have to see at different types of the research. And in order to do it, everybody has to give their own important findings in the research. Sometimes we always talk about having the systematic collection through published research. In the review of literature, I think most of you are thinking of different important research that should be reviewed. So I know that you all are thinking about how the review of literature should be done. May I ask you, give me one example each. If you are given the choice of doing review of literature, what type of review would you do? Starting from Mehri.
Ma'am, we will search the databases and include the studies which are relevant with our research.
Databases, let's say databases, what type of review?
Google Scholar, PubMed, ArcMedinet,
Okay, what is available?
Google Scholar.
Right, anybody else? Thank you, Mehri. Dr. Daud.
First of all, I would focus what the topic I am looking for. I mean, for example, in my case, if I select that how competent the physicians or healthcare providers are in, I mean, meeting the competency, cultural competency levels, I will go for the gathering the all the articles which have been written about the topic, and then uh, I will go for to what extent they are correlating to my study question. And
Okay, I don't think as 1 minute is left, so we would be having our discussion ended with the proper systematic literature review What is the difference between review of literature and literature review? The literature review is what you have written after reviewing all the literature. And what is a review of the literature? You went to the library, you went to the Google Scholar, to PubMed, Medline, all the published data, unpublished data, and you come up with literature review with all the commentaries that have been done. It is the process of reading literature. However, the literature review, it means writing. What have you seen in all those sources and what is your opinion about it?